Morning, guys. So welcome to Med Administration Lab. So what we're going to do today is talk to you guys about the process of passing medications, pulling medications, doing all your checks, and all those great things that you've heard about in class. Now we're ready to put it into practice. So we're going to walk you through things today. We're going to talk about it first, and then we're going to pause the video and actually do a live demonstration for you guys with a real med pass. Okay? So let's talk about this a little bit. You know, the big things with med administration is patient safety. That is the bottom line here. You have to make sure that you're doing everything correctly and you're at least minimally checking those medications 3 times. If you do it more than that, that's fantastic. If you do it the right way, it's not going to take you any longer to do your med pass than it would if somebody does a shortcut. So no shortcuts allowed here. There's been too many fatal med errors made because of that. So we don't want you guys doing that. So the first step that you're going to do, of course, is always walk into your room. You're going to bring your MAR into the room or your medication administration record. You want to have that with you before you go into the room so you can double check to make sure that you have the correct patient. So you're going to take that in the room with you and you're going to do your full AIDIT and you're going to let them know that you're going to do your med pass on them. You're going to ask them a few questions. You're going to look at your MAR and see, do I need to do any nursing interventions before I go get my medications? Things like checking a heart rate, checking a blood pressure. Maybe you have to check an apical pulse. You want to ask them if they're having any pain. So you want to look at those PRN medications or those as-needed medications on your MAR to see if you need to get anything additional prior to going to pulling your meds. Okay? So you walk in the room, you do your AIDIT, of course you wash your hands, you always have to do that, and then you tell the patient that you're going to be getting their med pass, you're going to check their name and date of birth. You're going to ask them their name and date of birth as you're looking at the wristband, and then you're going to pull your MAR right next to the wristband and double check it again. Okay? The other thing you want to double check on your MAR is there's a place that says allergies. Double check that with your patient to make sure that that in fact is what their allergies are, and ask them what their reactions are. That's really important too, because sometimes you'll see that the doc will order a med that they're allergic to, but they may have just a very slight reaction to it and they're okay to get the medication still. Of course, that would mean a consultation with your RN and maybe even a phone call with the doctor before you administer the medication. Safety first. Okay, so we've checked out our patient, we've gotten our MAR, we've gotten all the necessary interventions done that we need to do, and we're ready to go ahead and pull our medications. So step 1 is coming on over. In long-term care, you guys are going to use a cart that's similar to this. Okay, and in these carts they have things like stock medications, which are like really big bottles of medications that it's like what you get at the store. Like you can get a big bottle of Tylenol, a big bottle of cough syrup, or whatever. We call those stock medications. So that's what anybody can use. It's not specified just for that patient. So if they have that med ordered, you can go ahead and pull from the stock bottle. So you'll see a drawer full of those. You'll see a drawer that will have your particular patient's tray in it, or a drawer that has it in it. In our case, we have a little basket that would be labeled with the patient's name and have every single med that they ever had ordered in it. So we have to be really careful when we're pulling our medications to be sure we're pulling the correct ones, because we may not need everything that's in that med basket. Okay? Other things on your cart are going to be like your supplies. So it's really nice to have these carts because you have your syringes in there, your needles, your alcohol wipes, a handy clamp and a pair of scissors. You can have things like 4x4s, your tape, extra med cups, and all that kind of thing. You want everything you need for your med pass on your cart, which is great in long-term care. In acute care, things are set up a little bit differently. You'd go to a med room to gather some of your supplies. And we'll show you both of these versions when you come to lab. The other thing on your cart that you're going to see is probably a pill crusher, which is this here, and you'll get to try that out in lab. You want a tray because we're not going to take this cart in the room with us. It always stays outside of the room. And when it's outside of the room, you need to be sure that the med cart is locked because we don't want anybody going to the med cart and just helping themselves to the meds. Okay? So again, safety first. Other things on top of your med cart, typically in long-term care, there is a med binder. And you would open it up and you would see dividers for each of the patients that are there. In long-term care, they usually have a picture of the resident that's there so you can really identify that resident. You'd flip the page, you'd see an allergy page there, which is really great. So it's right in front of your face so you don't forget that. And then the next page would be the MAR. This is what a long-term care MAR looks like. And if you can't see it really good on there, we'll try to zoom in a little bit. You will certainly have an opportunity to practice in lab with this. So you'll see it up close and personal in lab. Okay? But you'll see on this, it's got the dates across the top. They're very tiny squares, but you'll see your name of your med and your dose or your medication, and then you're going to see the time that it needs to be administered there. The box that you're going to sign your initials in to say that you gave it is very tiny, so it's very important that you stay within that box. If you go outside of that box, it looks like you gave the med for the next day or possibly even the next shift, and that can cause a lot of confusion. So you have to be really careful when you're documenting your medications, okay? Other things handy to have on your cart are going to be certainly your alcohol, hand wash stuff, your gloves. You can have some cups here for any liquid medications. Your med cups are going to be really important to put your pills in and to measure your meds. Spoons, straws, all sorts of good stuff that you're going to need when you go to administer your medications. Another nice thing to always ask your patients before you leave the room is, how do you take your medications? Do you like them with applesauce? Because some folks have a hard time swallowing their pills. So they may want you to put a whole pill in a spoonful of applesauce, maybe even yogurt, sometimes ice cream. Just helps it go down a little bit better. It's nice to ensure that they can swallow properly, because if they can't, then we need to, give a call to the doc and say, is it okay if we crush some of these meds? They need to reorder them to say that it's okay to crush the pills, because some pills cannot be crushed, and that may mean a med change in the pharmacy. So we have to get a new order. So always consult with your physician about that prior to doing it. Another thing is, do you take it with juice? Do you like it with milk? Do you like it with water? A lot of our older folks like to take it with something other than water because of the taste that it has. Gives a bitter taste in the back of your throat sometimes. Milk is a really nice one because it's thick and it gets the pills down really easy. So, those are some things to take into consideration. Can your patients sit up? Okay, that's another thing. You want to make sure that they're able to sit up enough so that those pills can go down really easily as well. If there's somebody that can't sit up and they're lying flat, we may have to reevaluate how we're giving them their medications. Okay, so that's going to be, where you're going to come and you're going to collect your medications will be over here at this cart. And you're going to do that by looking at your MAR, and you're going to pull the necessary meds. So let's see what that might look like.